Greetings all. It gives me immense pleasure to announce that Online Dentistry and FindUtsav has collaborated to take education to at a greater heights. Today we have Dr. Jobby sir with us to highlight on what after dentistry. So, online dentistry was founded in 2008 with the main motto of redefine dental education. It has conducted more than 250 plus offline training programs and more than 1800 and plus online courses. Dr. Jobby Peters sir is the professor and head of Department of Pediatric and Preventive Dentistry at Annu Dental College and Hospital, Kerala. He practices and preaches the philosophy of catch them young and watch them grow. He's the founder and head of academics of online dentistry. Dr. Bino T. Ibrahim sir is the founder and CEO of online dentistry, an orthodontist, a passionate photographer. He has been an international speaker and has been speaking for ISPPD since last 6 years. Online dentistry has grown dynamically. It has more than 10 centers across India and will be moving further also. Today, we have Jobby sir with us to highlight on what after BDS that is much needed by all the interns and all the dental graduates. So I would like to hand over to Jobby sir to take further on this program. Thank you.
Yes, good evening, everyone. This is Dr. Joe. We have now 33 people in the audience, so let's wait for a couple more minutes. In the meantime, Dr. Simran, please feel free to announce regarding the competitions as well.
So all the participants, I would like to announce a very, creative competition to all of you, a orthodontic wire bending competition that we have launched a few days ago. And we have some of the craft, some of the, art that people have prepared, and we welcome you all to please give your entries and show your art. Arvind, please show some of the wire works. Yeah, we have some of the wire works that has been done by some of the participants. You can also give your entries. These are some of the works. Please move down. Move slow. Next. These are some of the creative works that has been done by some of the students. In this competition, you can use any wire, any orthodontic wire, and create a craft. And you have to mail it to us. I will send the mail ID in the group and we will be judging you on that basis. Also, you have to post it on Instagram, and on the basis of likes and on the basis of judgment by the judges, the winners will be announced. We have right now, we have got more than 100 entries, and in which we have selected top 3. We are still on for the entries. You can give your entries to me. I will send the ID in which you can click the photos of your craft and send it on the mail. And we are hoping that definitely you will juice out all the creativity that you have inside yourself of bending a wire. So please do give entries and show your talent. Thank you.
Yeah, Dr. Simran, I guess all the dentists have outsmarted us because most of them are on YouTube. We can see almost 150 people joining us live on YouTube. So, yeah, so I guess you can start. Joby sir, all the very best. Over to you, sir.
Good evening, Simran. Is my slide visible, Simran?
Yes, sir, it is visible. It is perfectly fine.
Thank you. Thank you so much for this invitation, and I congratulate you for the effort that you have taken for the entire dental community. For updating them and keeping them in track and making them updated with latest thing that is happening. So, welcome you all. I am Dr. Joby. I am in from Kerala. Work in Anu Dental College as a professor and head of the department. And you are always welcome to my institute. And Dentinos, thank you so much for that. So, this is my dental college. You are always welcome. Any support or any help with respect to dentistry and your career, if you want, you are always welcome to our dental college there. So at this point, I would like to congratulate all those who are listening to me who has passed BDS, who have become a postgraduate, undergraduate professional. I congratulate them. Or those people who are waiting for exams or waiting to pass out. I wish you all the best. Keep in track, And this session, which I'm going to tell, I have a disclaimer. My only thing is these are the collections and views of me interacted with my own students, my own friends who are working in different part of the world as dentist, non-dentist, but not in dental profession, dental related profession. So it's a collection of my experience for the past 25 years. The students has given the feedback and the friends who have given the feedback. So it is a personal experience and my own research and my own search into this, what I feel, and I just want to share this experience with you. So it's a purely Dr. Joby's experience and his friend's experience. So that's one disclaimer I just want to say. Let me start. There was two young executives, very vibrant young executives who were working excellent in their company in UK. So the boss of the company, after seeing their excellent work or record for the past 1 year, the manager called them and said that you are doing tremendous work, excellent. Now I'm going to give you a new task for you. The task is the company want to grow into newer places. So we selected the next continent that we want to expand. It's African continent. We want to expand our company into the African continent. The company was a shoe making or a slipper making company there. So they want to expand to Africa. So what this manager said is, before establishing ourselves, let us go and find out a research. Let's see whether there is a scope of a company like this in that area. So they've set out into Africa. They went, both of them traveled across Africa. They interacted with all the people. And after a week, they came back to the manager and they were about to submit their report individually. So the first executive came forward and submitted the review and told the manager, sir, there is no potential in Africa for our company. Since we are a shoemaking company, there is no potential, because I come to a conclusion that nobody wears shoes in Africa. So do not even think about going into that place. So he submitted and he went out. The next salesman came, the guy came and he said, sir, there is an excellent potential in Africa, sir. I interacted with that and I observed and I have pictures, and I'm telling you, sir, our company is the best potential to do that. We should do it. I said, why? The other person said, there is no potential because nobody wears shoes. No, sir, there is an excellent potential, because the reason is nobody wears shoes there. We will be the one who will be the highlighted there. So we have to work on to that. See, guys, it is going to be a situation is same. The approach is different. Now, the same situation when you approach. So every difficult situation, a task in front of you has two options always. Do not stick on to one option always. Think in from different perspective. You will find an answer. If you're stuck with something, go into a different perspective, thinking from a different angle, relax and see and thinking from different perspective. You will get a better opening in that perspective. Why I say is this, what after BDS at this point in India, You tell me it is like always when the day that you joined and the day you are passing out, and after that, everyone is asking what scope you have, man. Dentist, what scope you have? No scope in dentistry. So the option or the feedbacks that you are being receiving from your seniors, from your neighbors, relatives, whatever it is, there is no scope as it is fully saturated and there is no scope is there. But there is other side of dentistry which is least explored. There is a good option, there is good scope with this branch. It can change a platform from where you have come and you are elated into a different platform. From there you can catch up, and there is excellent scope with dentistry. So all you need is to think differently, observe differently. And let me tell you, in this world, any professional job, if you take, only 10% of the jobs are visible. 90% of the jobs are hidden. It's like an iceberg hidden inside. And those people who just follow the 10% will fall in the trap. But those people think differently and find out the 90% hidden opportunities in any profession. They mint money and they become very famous and satisfied in life. So for this, you need something called passion. Passion, something called confidence, something called positivity, something called I will overcome this attitude. Negativity is being elated or deleted from your entire life. Positivity at the best you should have. So BDS, Bachelor of Dental Science, BDS, has got many opportunities. And I am going to, if you see, there are so many opportunities starting from government job to clinics to MDS, opportunities outside India, settle outside India, research in dentistry, which is least in India at this point of time. And we have the maximum capacity because we have such a good crowd we have, and we can do a lot of research, and many international companies are looking to India to do research with respect to lots and lots of material wise, new technique wise. Big companies are aiming India as a hot spot for research, and it is coming up in next 5 to 10 years. We will bloom up with that in India and outside India. Career change, if you want, if okay, fine, you are not fit into this, you feel that fine, it is not my piece of cake. But with BDS, what upgradation I can do in my life? My passion is something like, but what I can connect with that, and I can change this and use this as my platform to upgrade myself. Because you are a doctor, you are a very reputed person in the society at this point of time when you get awarded as a BDS. From this, what upgradation, utilizing this, what next related profession I can work? It's an amazing thing when you think that, and you will be at a edge effect when you apply this in your practice there. So career change, even though you do not want a change in career with the background of dentistry, is the best at this point of time. Let me tell you, I will tell you when I go into my slides, I will tell you, if you think that this is not my piece of cake, I am trapped, wait, my last few slides will give you, there is an opportunity. Use this as the best to upgrade your career, and change of profession attitude will come there. Okay, so that also be. So with respect to, let me tell you, I have researched and I found out, and I want to tell you that there are 112 and plus increasing professional opportunities are there, being just a BDS guy. And if you apply everything, it is infinitive. It's you just listen to the last slide, then you understand it is infinitive. I can grow, I can be a different person, what I want in this professional life there. So to start off, let me, government jobs are there, conventional way. If you go, I mean, you have a passion for dentistry, you want to be a dentistry, and you want to be into a government job where you have secured, you have a gazetted rank kind of situation. If you want, you can grow, then government jobs are the one thing. But so with the BDS, after BDS, what government jobs? See, options are very limited at this point of time. But you have options in the state government, respective state government and central government. There are opportunities are there. Third opportunity could be government funded companies are there, which they appoint a resident dentist are there. I will discuss this one. So state government, suppose, see, I told you I'm from Kerala. So there is a sometime opportunities come as they post dentists in district and taluk hospitals as a resident dentist they do, but you need to go through a PSC. That means the Public Service Commission examination of the respective state. You need to go through, you have to pass through that. So in Kerala, it is like in different states, you have to search the state government Public Service Commission examination website where they will announce it is open for this kind of post. These things are open. This much number of seats are available. This much number of posts are available. You can apply if you are passed out from BDS there. Then NRHM and NHM, National Health Mission, they have state-wise and central government controlled NRHMs are there, where opportunities are. They appoint dentists for resident dentists, they will appoint there. So there is another opportunity that you can come. Now, central job after BDS degree. Army Dental Corps is a good option after BDS because they appoint dentists there and you can join as a territorial officer in Indian Army or in Indian Navy as a contractual dental officer. You start off your career with this. Once you start off this career, then there is an opportunity for you. They themselves will send you for post-graduation, depending upon your work, you can qualification, they will send you for post-graduation with a bond that you have to give to them, and they will give you free education for a post-graduation of the branch that you want. So that opportunity is also there. So I just want to tell you one person whom I met is Dr. Major Pavitran, who after finishing BDS, what he has done is he has gone into Army Dental Corps. Let's listen to his experience and his advice to you, what you want to do there.
Hello friends, I'm Major Dr. Praveen, and today I would like to inspire all of you with my little story. In the year 2003, after I passed out my BDS from Ramachandra Dental College, I was very worried. I was thinking how to improve my life or what to do in my life. I was clueless and I was preparing for my postgraduate exam. In the meantime, I got a call letter from the newspaper saying that Indian Army is looking for dentists, and I went and told my father about this. My father was very upset about this. He said, I didn't allow you to study BDS to go and work in the army. I want you to come to my native place, Thuthukudi, and start a clinic so that I can tell everyone that my son is a dentist and I will make you a successful person. I said, no, daddy, I want to do something different. So he was very upset, but he helped me. Finally, I got through the army selection. I got through the interview. I got through the medicals. And after a waiting period of 10 months, I got my call letter and I joined the Indian Army in Jhansi. So from Jhansi, I was sent to Lucknow for my medical officer's course. Then after that, I was told to go to Jammu Kashmir to serve the country there in the counter-terrorism and intelligence operations for almost 2.5 years. I understood one thing. Indian Army always told me, you're an officer first, then only you're a doctor. So army duty is always given priority there than the medical duty. This was a bit upset for me because I want to do more of cases and more of dental work. So I was told to go to various places, given a lot of experience in various administration activities, management activity, event conducting activity, a lot of exercises and so many things I've done in my life. To be very precise, in the year 2009, if you would have watched the funeral rally of late Y.S. Rajasekhara Reddy, I was there carrying his body. Even in army, everyone, whenever you wear a uniform, you become a soldier, you become an officer, and there is no turning back, and you have to do the duties of your country first. So I decided, okay, let me come out of the army and start my own clinics. It was a risky decision because I was given a nice pay, a good quarters, a good respect everywhere. They salute me, and I took a risk of quitting all this and start my own venture. Today you can see my clinic. I have 3 such clinics, beautiful clinics. I have more than 10 to 15 employees working for me, and I have 4 or 5 doctors working for me. And I even conduct my own courses on various subjects like implants, practice management, boot camps, and so many successful things. The one thing I understood in life is success is not in the degrees you study. It's not in the college you study. It's in your mindset. Success is a mindset. If you believe, you can achieve. If you think you can, you can. Why I'm telling you all this, I was once a normal person. Then later I realized I can do this in my, I just reached one success in my life, like getting a job in the army. It changed my complete perspective. Just wait for your one success in life. Life will change forever. It could be an MDS, it could be your own clinic. Your life will not going to be the change. BDS is an awesome subject. Please do the subject very well. Come out in flying colors and apply for anything. Don't waste your time. Apply for anything. And I'm so glad Dr. Joby Peter has given me this wonderful opportunity to share all of you my life and my difficulties so that it inspires you. I hope I've added some value to you. If you would like to follow me, please go to YouTube and click Malligai Dental Academy. I will be there. You can follow me in Instagram as Major Dr. Praveen. I would be glad to help you in interviews and things like that. Thank you so much, and God bless you. God loves all of you. Thank you.
Thank you, Dr. Praveen. I mean, amazing. So this is where which I've told you, the BDS has got a lot of scopes and opportunity there. Then goes on into the next part of this is the central government is UPSC dental surgeon examination, where if you get selected in UPSC, you will be posted by Ministry of Health and Family Welfare and assistant divisional dental surgeons in Ministry of Railways. So these two windows will open in front of you, which you need. Again, you have to follow the website address I've given you. Those website address, they announce the vacancy, announce the interview, announce the exam and interview. You need to prepare for that, and you can get through in this, again, central government job that you have. ICMR, Indian Council of Medical Research, they search dentist, scientist, and D they call that. The category is scientist D called dental. So Department of Health Research, Ministry of Health and Family Welfare again comes under ICMR. The ICMR project comes under. So a lot of research kind of oriented. They need assistant dentist, BDS, and even MDS. They look for it. Also, Defense Research and Development Organization, DRDO, dental officer appointment also comes in this UPSC examination. If you clear, you get that. AIMS has got 22 centers across India at this point of time. They also take BDS for the lecture post they take in BDS. So that is also another option if you want to go into central government. So all you need to go into their website and look for opportunities. Recently, many opportunities that has come in different parts when they started taking up. They first take the medical and then go to dental opportunities. They take dental officer. So that comes in each states whether the AIMS is newly starting. So that you have to follow it up. So that is also again central government. Now comes government job after BDS. So government-owned companies. This is not a direct government job because it's like a company which is owned by the central government, or the major share is from the central government, like NTPC. Their website, if you see, they do have hospitals for their employees, and those hospital has got a dentist is required. So BDS, even as a dental officer, you have opportunities in NALCO, ONGC, or some of the companies I'm telling you. These all companies which are government funded companies which are require a dentist in their hospital for their employees. And so you have to specifically go to the particular company website and look and search for whether they do have an opportunities there. Then comes another central government. This is ex-serviceman contributory health scheme, Ministry of Defense. Again, ECHS, like after the defense, they got retired or their bond is over. So they are going back, and for them, they have health care lifelong and medical and dental life care is there. So they have specific hospitals for them to get these services to be done there. So there is an opportunity for dentist. There are 29 centers across India. ECHS centers are there, and you need to find their website. They add, sometime it comes in newspaper that ECHS in so and so area require a dentist and apply for eligibility criteria, they might say that. So ECHS is one solution there you can do. Second comes as Employee State Insurance Company, ECSIC. There are 145 ECSI hospitals and 42 hospital annexures in India at this point of time. In state, there are 9 centers in they are all run by the central government funded one, and they also require dentists there. So here also there is an opportunity for dentists. You need to go to the website and find out whenever they call for dentistry is there. So that is another opportunity that you have. Now, that is about the central government and state government opportunities as a large kind of things and options, that kind of things that directly under central government or their supported companies, you have opportunities there. The next one I want that you can join in a private college as a lecturer after BDS, but the remuneration and everything at this point of time, India is very less at this point of time. But joining in this you should have a plan. You should have a plan. What is the plan that you have? The plan is like you have to select a department where you want to work, where you are weak. You identify your weakness first. Like I'm very weak in extraction. Fine. So I want a department where they're like a oral surgery. Post there, be with them, start doing cases, get maximum experience from there. So if you are weak in root canal, post in endodontics. Like that, you have to select a department, and you when your interview tells, sir, I'm ready to work, but I need posting maximum in this kind of department where I'm weak. I want to improve my skills in that particular department there. Or you need a 3-month rotation. Then only some kind of things, some kind of talking you should initially do when you join in this kind of things. Otherwise, it's like select a clinic as an observer or shadowing them. Do not expect any money in this kind of situation. That this is shadowing, because your dental education in your 4 year is a confined, refined one. Private practice is entirely different. You need to work under, if you want to start a clinic for, let me tell you, you need to work under a very reputed, very pronounced guy who is doing good in your area. So find out who is doing very good in your area. Anybody. Go under him. Sir, I'm ready to work. I want to learn. That is my aim. That is called observership or shadowing. That is happening across the world with that. So you find out. The advantage is, it is not monetary thing that you should look. This is a preparation time. You are preparing your future. You work under him. You see the flow of work there. And you analyze first thing, is dentistry is for me or not? Take a decision. Is dentistry is for me or not? Because you understand, okay, fine, I can manage, I can understand, I can do everything or not. Second thing is, which is my passion? In dentistry, which is my passion? I'm passionate about one particular aspect. I'm passionate about this. You decide under that time. That's a planning time. Do not think about monetary at this point of time. Plan. And you select somebody, work under him. I'm ready to do it. No monetary benefit, but this is a planning for your future. Please do that. Many people crib and say that, sir, I worked there from morning 9 to 10:30 and he did not even give me anything. That is the best. Do not give. You work and find out what is your passion. You analyze what is your passion for 1 or 2 months. You work on to that. Do not be a subordinate for lifelong. You find out your passion. Find out what you want. Is it my field or not? Do not get stuck. Yes, 6 months now, I know what is my passion. Let me work on to my passion. Let me work on to this. Let me study. Suppose you understood endodontics is what I want to do. I'm passionate about it. I can handle it. You work and do an MDS. From this, you go for a higher MDS or something like that. You go. Suppose surgery, go for it. Pediatric dentistry, go for it. Implantology, go for it. That is how you can grow in your life. It is like step by step you have to grow. There is no one formula you eat or you drink that you become one. No, it is not possible in life, in professional career. That you have to go step by step, understand your passion and go by that. So just to summarize what I said to you, there is an option called MDS which you want to do, but find out your passion. I always tell, please find out whether this branch is for you or not. So go for shadowing, go for work under somebody who is very good, work under and find out and find, then only you go. Just name MDS is not going to earn you anything. Being an MDS in orthodontics, being an implant, we can see so many failures. We can see, you have never seen those failures of people with MDS. That is the problem. We never look into the failures. We always look into the success. Actually, we look into the failures of people with all those gadgets they have. PSC, I told you, UPSC, I told you, Army Dental Corp, and government funded companies are also there. Now, if nothing is your passion, that means to say that I do not want to be in my country. My passion is to little go abroad, enjoy your life in a different way, different perspective is your aspect. Then abroad option comes. The option comes with your passion. Yes, I just want to earn more respect, more kind of comfortable situation I want to work. I'm not comfortable with this kind of situation that is happening in our place. I'm not ready. That how did you get this idea? After shadowing or after working somewhere. Unless that you can't have that idea. So you have to work under either in a college or under somebody you have to work. Then only you'll get it. No, this is not comfortable for me. This is not good for me. You got a very clear silver line. Yes, I want to go one step ahead. Then abroad could be a good option for you. You may be built for that. Options like dentistry as a profession, as an associated job, or a change in profession with dentistry is amazing in abroad, which I will discuss there. So countries, you can talk about Middle East is a very good option, but BDS options are very less. Countries like US, Australia, New Zealand, even Toronto, Canada, and Middle East, your Asian countries and Europe, there are very good opportunities in these countries there. The problem with these countries is that the basic BDS or even MDS is not directly recognized in these countries there. These countries are the pioneer countries where they seek dentists there, but these countries, our BDS degree or the MDS degree for that sake is not directly recognized. You have to undergo a process of either license or recognition or some training. Some different countries have got something like that. Some countries, if you undergo a examination, a licensing examination, they accept you. Some countries, even after the licensing examination, they stress that you have to undergo this much years of training in a reputed or recognized or that country's recognized training you need to undergo. So that difference is there for different countries. For example, Germany, if you want to go and work, they have a licensing examination. If you attend this license examination, you get past this examination, then you can apply for job or opportunities and you can work. But there are countries like US, even though you clear everything, but there is a protocol, strict protocol there to undergo. If you are a BDS or MDS, you have to undergo this protocol, and then only you will be given a license to practice in those countries. That's the only limitation, and you have to watch out what are the prospective norms those countries which say there. So if you want to go outside, my dear friends, I want to tell you one important thing, that there is something called shadowing or observership is very important. Because why this is important? There are before going, see, it is very easy. You might have seen your friend when he started, but let me tell you, you go into these countries, whichever country that you want to go as a tourist visit for a month, as a tourist visa. You take it for 15 days or a 1 month. You go for there and try to get an appointment. You have to plan very well to a dentist and work under him. Just observe what is happening in that country. What is the normal norms of practicing dentistry in that country? Very, very important there. So these 4 points I would suggest you to do first if you want to migrate from India, rather than being in a well, like the frog in the well. If I go to US, I earn this much, or if I go to UK, I will earn this much. Please do not have that wrong perception. Let me tell you from my experience, people have failed after going there. They could not do, they lost. They were in two boats, neither there, neither here, because they have not done the groundwork. The groundwork in these countries, if you want to go, is this 4: shadowing, observership, perceptions, and externalship. You have to undergo this. Then you will get an idea, is dentistry in these countries are my piece of cake. I am able to perform perfectly under the norms and guidelines, because the charges in these countries are exorbitant. You cannot compare with India. Fine. A simple consultation is around $300 to $150 to $300. You can imagine how much it's in India. So why it is like that? Why? Because there is a protocol they have to follow. They will tell, and if they fail, the clients can complain and you will be in a big trouble there. So observe that strictness or stringent methodology they follow, and then only go into these countries, blindly go there. Because if you take a DDS also, you come back to India, you are a BDS. DCI doesn't recognize that you are a BDS. No much improvement you can get there. So if you are taking this bold step of going outside, make sure that I want to settle down there. I want to be a dentist that country. I'm ready to follow the protocols there. So 15 days to 1 month of this procedure will be good there, because the dental treatment approach is different in these countries. Totally different. Starting from appointment, pre-appointment consultation to appointment to the procedure starting, it's different. The explanation for each treatment is different compared to India there. Show your dedication, because this 1 month, the dentist there will, okay, you are a dedicated, you are not you have a passion for it, and they will support you. They will give a good recommendation for you, saying that he's a very dedicated doctor, is interested in that, doing that. Networking. Once you go there, you know the clinics, you know the different types of protocols that is happening in different clinics, and new things that is happening there, and you get connected with the local dentist, the association. You know the more opportunities coming in the local papers, where you have opportunities for this. You know the scope of dentistry. You get more connected with the people and say that, oh my God, there is a good demand, and such a good dedicated person like you, definitely there is a good option. So you get good networking there, and definitely you will improve your skill. You will find that, okay, my God, the way that we practice or learned is totally different. I need to improvise myself. I need to get into their level. I need more training required there, and you will be more responsible and dedicated to this field there. So that is the importance of this shadowing, observership, and all those things. If you do, then take the call whether I want to be with this or whether I want to quit or go or move on to this. If you feel, yes, this is mine, I am happy, I can do this, I want to be settled down this, then there are certain tips I want to give you. The observership in periodontology for foreign trained dentists, Ohio State University. There is a website. There are different websites like this. You have to search and find out. They allow observership for 1 month or whichever time that you want. They have a specified time there where you have to pay to them, but they will give you, you will allow to observe the current practice in this particular state. Very, very important that you need to do. For example, NYU, New York University, they have an observership program, summer observership program, where the foreign dentist comes and they get trained with preclinical to clinical. They get trained. It's like you have to improvise or improve your skill. Okay, you are fine. Then only you go for the patient wise one. So that kind of well trained, tailored programs are available. Please do search for this program. Go on to this program, find and feel, okay, this is my piece of cake, I can do it. This is a better field I can work on. So that, please do that there. In dentistry, let me ask you, in dentistry, there are certain key points to be successful in dentistry. There are multiple questions come to you. Can you become a successful dentist? Can I become a who is a successful dentist? There are multiple things you can look around. Now, in Indian scenario, a successful dentist is been judged as by per day number of patients, or the square feet area, the number of chair kind of thing could be the area which we consider that. But let me tell you, in my experience, a successful dentist, one of the most important tip I want to tell you is you should be a good communication skill. If you have a very good communication skill, almost 50% of dentistry you will cover. 50% is your skill, knowledge. There's no doubt about it. but communication skill with your patient, with your staff in your clinic, with everyone is very, very important. So if you want to go into abroad, they give specific preference to practice management in dentistry. Practice management and financial management in dentistry is equally important as your skill and your knowledge. That is also important. Your hand skill and knowledge is upgradation is very important, but equally important. You cannot put one down and one up. Is communication skill, finance management skill in dentistry there. Please do learn about communication skill. I survive 50% of my practice with a good communication skill. No patient till now has argued with me or got left me because of this communication skill. Many times patient comes to you, you treat them, nice treatment, everything. Because of lack of communication, they will never come back. They somehow get the treatment and then gone, vanished. But in my practice, patient keep on coming, on referral comes purely because of definitely communication skill is a part of your skill and your effort. That is also there. So they will communicate, and very important point is how you communicate with your patient, with your parents. Patient is very, very important. And especially if you're planning to go, it's universal across the globe. You practice in Brazil, you practice in China, you practice Indonesia, Nepal, anywhere you practice. Communication skill can take you into a good practitioner, provided you are supported with your skills and knowledge there. One of the example I want to tell you, I don't know how many of you know this guy. Anybody knows this guy? Can you come to the chat box and tell who is this person? Anybody in the chat box? Can
Sir,
you?
he's Sandesh Maikar, the father of aesthetic dentistry.
Exactly. Sir, he is one of the guide you have to follow. Sir is a good communicator. His skill is definitely 100%, but sir, as the communication, the way he interact and his practice management classes where he stress the importance of communication and making the patient understanding, that is so important. And let me tell you, his clientele are none other than any of the Hollywood or Bollywood, or especially Bollywood actors want to in dentistry. He's the father of aesthetic dentist in India. And he's an oral pathologist. So non-clinical oral pathologist is being named as a clinical head of aesthetic dentistry. You can imagine the way that he treat his patients and the communication. Definitely skills are there, but communication, what he present and stress in his practice management is worth to listen there. This is another guy, another doctor whom I used to work, Dr. Rajkrishnan in Kerala. The you can say the busiest dentist, the most expensive dentist, and he's the father of tourism dentistry in Kerala, where he brought tourism, and his clientele are from across the globe, some 27 to 30 countries, and he doesn't treat Indians at this point of time, very less of Indians at this point of time. Main uh, pre-booked foreigners are coming across the globe, they come for a package of tourism and does treatment under him. And he has got a multi-center at a small town called Tripunithura, where I'm residing, and this is a panel. I am one of the panel in there. So the way he interact with the patient, the communication skill is amazing. Dr. Rajkrishnan is an endodontist, passed from GDC Trivandrum, and he's amazing they do. So guys, if you want to be in India, I told you these are the people who are doing extremely well in India. But if you are thinking that you want to go into outside, the American dreams doesn't have any limitations. There is no limit in American dream. This is Dr. Herman Ostro. He is just a basic degree he has got, but practiced for 30 to 40 years. And he earned so much that he just during his retirement time, like he say, I'm quitting dentistry, I'm going for rest because he has done enough. Then he just donated 260 crore to the college where he learned his basic degree there. And now the college has rewarded him with the or honorarium given to him, that Herman Osto School of Dentistry of UCSC. So that much, that much earning you can do in America if you are planning that. This is another guy who started with a simple product, Dan Fisher. He started with a simple product called gum paint. Now he has got 1,600 products across the globe, and with 1.1 billion turnover. He started with this gum paint. He is the one who introduced the gum paint astringent for soothing the gums and the gum inflammation there. But he has grown into multi-million business guy there. So dentistry in USA is amazing. It's very good, but it's a struggle to get into that. You have to work hard. So first and foremost, you have to get educational credential evaluator, EC evaluation, verification of the procedures for non-accredited dental schools, because we all come from the because we are outside. So it is a non-accredited dental schools, and we have to go for integrated NDB. Now the national board has changed integrated one. We have to prepare for INDB. Then you have to get the dental pin. So you have to apply for the dental pin to get into that. Then you have to apply for the American Dental Association for INDB. Then schedule the examination. Select a prometric center for the examination. In India, there are some centers, or you have to go to directly there. You have to score that INDB and get a pass or a fail. Then you have to apply to the universities for a 2-year or 3. Some universities, they say that you can directly enroll a 2-year program. Some says that a 3-year program for DDS or DMD courses there. Then after passing, then again you have a licensing examination. Depending upon the state in US you want to practice, then you can practice as a registered dental practitioner. So it requires minimum 4 years, but sometimes it's up to 6 to 10. I even have seen 10 years they are struggling to get the examination because of personal reasons there. You need a good financial backup for this, a tough examination process. So you need a heart of lion and a mind of an eagle to get into this. But once you get into this, let's listen to a person who's doing the same program in US now. She's graduated from India. It's a BDS.
2016 from Maharashtra University of Dentistry. After working about 2 years as an associate dentist in Maharashtra, a DDS or DMD program. Now, for foreign dentists, there is an advantage that you don't have to do the entire 4-year program here. You can get your degree within 2 years or within 3 years as recommended by some colleges. It purely depends upon where you get admitted, where you are getting your admission from, degree from. So yeah, that is it, my journey so far.
So guys, that depending upon this, you can get into a 2-year program or a 3-year program in US there. The thing is, once you passed out in US with your basic degree, you start earning around $19,000 per month. It can go up to $31,000 and go. There's no sky is not the limit. In Indian scenario, you can see you're talking about 30 lakhs per month you earn. Yes, the earning of a dentist is considered to be the second best professional thing in the US, and they're all job second and third. It varies, either second or third. The best or the maximum earning in US at this point of time there. So, but you need to struggle. That's it. Now, is there any program without DDS? This is a program which I mentioned you with the DDS. Now, is there a program without DDS to get into that? Yes, there is a program. The problem is DDS means you are clinical practitioner. The other programs means you cannot touch patient. It's all research oriented. There's something called MS in dentistry. Suppose you do not want to treat patients, there's something called MS in dentistry. So MS in oral and craniofacial biomedicine, MS in oral biology, masters in prosthodontic orthotics, MS in dental materials. Here, the cost is also less. You don't have to go to this stringent procedure there. There's procedures, the protocol is very liberalized. It's like you work in a college, you study a post-graduation in that college, but you don't have any patient exposure or anything, and you pass out. Some companies or some firm will directly appoint you, get a job offer as a research person or a advisors into that company there. So the cost will be around 20 to 25 lakhs that you can. But here the problem is your BDS time. What is your GPA? What they mean GPA is like average percentage. They call percentile. Like every year, collectively, all the 4 year, some university take only the final year, some university take entire 4 years. What is your average percentile? So that would be very high. In this GPA, they also see whether social services that you have done, like community camps and social services, working in these debilitated hospitals or all those things, trauma centers and all those things, and getting a certificate. And when you apply into the university, keeping those certificates of working in a trauma center, in an old age home, in an orphan, in a kind of social services camps and all those things, the greater the number of social service that you have, you get a greater GPA and you get a greater acceptance into that particular universities. And certain universities even give scholarship provided you have a very good social services record that you have there. So that depends upon each university there. So if not US, then come Australia. Australia is again another option that you can do. So here you have a 3-stage assessment by Australian Dental Council there, where there is an initial assessment, written examination, and a practical examination is there. So you have to apply for the dentist licensing examination to the Australian Dental Board. You have to apply that I would like to take up this. So this will review your eligibility to give the dental licensing for practice there. So then once they give the license, then you have to search the job, and then you have to support the finance there. So this is one of my student who is working as a general dentist in Australia. Let's listen to her, how he went and what is her recommendation for you to go to Australia.
Hello everyone, good morning. This is Dr. Kamna from Melbourne, Australia. I'm a general dentist practicing dentistry in Australia. I really would want to thank Dr. Peter for giving me this opportunity and privilege to be able to share my journey and to be of help to all those aspiring dentists who really want to have a career in dentistry out of India, especially in Australia, because that's where my journey began. To start off, I would want to mention that, yes, we all know the protocols of giving the exam, arranging our visas, getting your job, and then slowly moving forward. So regarding the exams, you can find all the information on the website or give the Australian Dental Council a call and they will guide you very well in this regard. A lot of rules around the exam keeps on changing from time to time. So yes, you need to be updated. You need to make your own peer group of people who are giving a similar exam. So you're all in the same boat. You all are supported and guided with your friend circle of ADC aspirants, which is very, very important. But yes, you need the right kind of guidance. So you need the right kind of mentor to help you and help you move forward. It is a very stressful exam, not only in terms of preparation, but yes, financially as well. The journey doesn't end there. Even if you clear the exam, you have the next step of arranging your visa. The next step after that is getting your first job, which is also a very, very tough, it's a tough path. So the first 2 years in dentistry, again, needs a lot of effort, a lot of learning and relearning, because dentistry is practiced a little differently here in Australia. There are a lot of things which I can talk on and discuss, but considering the time frame, maybe I will leave it for next time. But I'm happy to take up any queries from anyone, so if that gives people more clarity. The first 2 years of your practice are the most important because that is where your foundation in dentistry is laid. So you need to be very hardworking, very focused, and very empathetic, and yes, have a very, very strong passion for dentistry, because that is the key. That will really give you the push to move forward. At the end, I would really want to mention that no matter what, it is a very rewarding, very satisfying profession. And in Australia, you will really not regret the hard work. So all the best to everyone, and hopefully all of you reach your dreams and your goals. Just be consistent and put in a lot of hard work. That's all that I can say. Lastly, thank you again, Dr. Peter, for giving me this platform.
Thank you, Dr. Kamna. Thank you, Dr. Kamna. So that is the testimony. See, I told you, my all presentation will be a live testimony of my own students and supporters who have been working there, lively what is happening and what they're enjoying. No hidden agenda in that. Let's see Canada. Another big option coming up is Canada, and you have to clear the NDB examination. Let's listen to him.
I'm Peter from India. I completed my master's from Annamalai University in 2009 to 2012. Currently, I am pursuing my second year BDS in Dalhousie University, Halifax, Canada. In order to become a registered dental practitioner here in Canada, you have to give a set of national board exams. So the dental journey here in Canada begins by giving the Part 1 exam, which is called as the AFK. So once you clear the AFK, that opens up two pathways. You can either continue to give the second part and the third part, or you can go and apply for the various universities here in Canada and get accepted into their DDS or DMD program. So this pathway is called as the equivalency process, and this pathway is called as the university admission process. So either of these pathways culminates in a common pathway called as the certification process, which is nothing but giving the OSCE exam and the written exam. So once you clear these two exams, the final exam is called as the licensure exam, which is nothing but a certification exam which you have to give according to the province which you will be practicing here in Canada. So this is a small gist about how to become a registered dental practitioner here in Canada. So I thank Dr. Jovi Peter.
So recently he has posted me a video. He has cleared all the exam and he is eligible to practice in Canada at this point of time. Congratulations to Dr. Subramanian. Thank you so much for the video. So hopefully he is taking more than 11 lakhs to 15 lakhs per month as a salary in Canada. There are countries like UK, New Zealand, South Africa, Brunei, Germany, Spain, and Netherlands. There are opportunities for dentists, demanding opportunities for dentists. The only thing I told you is BDS is not accepted. You need to undergo their licensing examination and pass that and get into the good opportunities are there. In UK, to get into UK is toughest thing, but you can go into UK with the BDS as a dental hygienist or a dental therapist. So the difference between hygienist and therapist is the salary wise. Hygienist is only able to diagnose or write and do some scaling and cleaning, but a therapist will be able to do even primary mobile tooth extraction to some kind of fillings they will do. So the salary wise difference for a therapist starts from 330 to 60 pounds per hour, and many clinics attend them. So you do the work in the clinical hours and then you prepare for yourself for the licensing examination called ORE or MFDS there. So that is an opportunity in UK. You can do many of the, even I know many of the endodontists, many of the postgraduates from the went as a therapist, registered therapist, they went and they're working as a 600 to even 800 pounds per hour they are working, and they are preparing for ORE and MFDS, and once they clear that, they will be upgraded into the next level of practice there. So guys, the comfort zone, you can be at the comfort zone, you will be always at the comfort zone, you will never grow. But if you want to grow up, you need to look the opportunities there. Now in India, there are some other opportunities which I want to just finish it off. I'm done with my presentation, like hospital-based clinics. If you are into starting a clinic, if you are not confident to start an individual clinic, why don't you try seek in your area where there are polyclinic or hospitals are there. In that hospital, one setup of a dental clinic, the advantage is you get a lot of referrals, get connected with them, get a good networking with them. They will start referring you patients. So you don't have to worry about patient coming, and slowly with your good communication skill, with your good hand skill and knowledge, you will work and you will never ever regret in starting a clinic in hospitals there. I have one beautiful center called KMC Medical Center, where there is all specialities of medical profession, where I've started the center there, and it works well there. It really works well because patients comes for medical reason and they refer to us and we do treatment. So you have to do anything every day. This much number of fixed patient comes there. Suppose you are not interested in clinical research is there. It's something called MSc or PhD in clinical research there. There are many certification courses there which widens your horizons there. So you will be, you have so many opportunities as a dentist to go for MSc or PhD in clinical research there. Like a clinical research associate, manager, coordinator, counselor, project manager, research officer. Like there's so many opportunities are there for you in clinical research there. So who appoints you? There are many companies like Abbott or like Pfizer. So many companies are there who want these clinical researchers in this field. And if you are a dentist, you have better opportunities there. Many global companies also appoint you. So if you are not ready for working in the patients, this is another opportunity. The white collar job, you can say, where you do work in research or coordinate with the multinational companies, and you can get good payment for this also there. Then comes dental innovative lab technology. It's a big field. With the invention of artificial intelligence, BDS doctors has got a better opportunity, unlimited opportunity. Many companies are coming up with AI, and with AI, they want a dental doctors to be their guidance there. So companies like Dentcare, Max, then Ortho, so many companies we know, many companies, many lab are appointing dentist and MDS people for their guidance and approach. So you have a better opportunity. All you need to have get updated and good communication skill you want to do. MPH is another opportunity for dentist non-clinical. This is our non-clinical I'm talking about. Clinical is done. Non-clinical MPH is good opportunity where the syllabus is unto this. Who appoints you as an MPH? WHO. Okay, big companies who does insurance and who does social services there. UN, Clinton. So big companies require good MBH people there. So the salary starts from 3 lakhs per annum to 15 to 25 lakhs to 30 lakhs there to 50 lakhs when you reach the company head there. So as a dentist, you can start off and you can reach and you can upgrade yourself there. But the only problem is international company. You need to fly, you need to be there, and it's a very hefty job, but you get a good remuneration for that. MBA is also with after dentistry. MBA is a good option to do that. The advantage of dentistry doing MBA is you can select different branches in MBA. So branches like marketing and administrator or MBA who has got connection to hospitals. In every hospitals there is an MBA now. Since dentistry has got many terms and terminology which are already covered, all those things. It will be easier for you to acquire this and become a big master compared to a +2 guy or or other people who do not have to have any idea about this dental terminologies or medical terminologies. Since you have that added advantage, MBA, a dentist appointing, I know so many people. I know in Apollo Hospital in Chennai, I know a dentist who is working tremendously, very good with MBA. She's a BDS, but she has got MBA and she's working perfectly, and they prefer her because she knows how to interact with the doctors, how to deal with them. So nice connection and communication is being maintained, and they are very happy with the BDS degree she has got and how she connected with everyone. So that could be the pharma companies, and lab will be the one that you appoint. You might be receiving many mails like this insurance company with a lot of tags and a lot of articles into that. Some kind of insurance companies will be appointing that. This is called dental or medical content writers there. Another opportunity that if you are a good creator, if you are good in vocabulary and knowledge, this is another opportunity where you sit in your home and you can earn money You can register into the company as a content writer or medical writer. What they might say, tell you a topic, and you write onto the topic of patient general information, and they pay you. And as international companies pay you $50 to $100 per hour you spend with the company. So there is a log. You log into the company. They might give you a task. You see the task and you write a content and you submit it within an hour. So it will be like $100. The content is very good, very innovative, very patient attractive. You will be hired there. So to learn more about it, in India, Institute of Good Manufacturing Practices in India, and this is a website where you can get training, a diploma in medical writing, content writing, you can get in this institution there. So that's a good thing, that if suppose if you do not want to go to clinical practice, you can think about it there. Again, many websites or many big companies are asking for dental blocks. So companies, health insurance or websites and hospitals are asking for medical or dental blocks. So that is also an opportunity. In home, you can do this, register into them and do this and give them, and you can earn. Some good companies give you starting from $100 to $150 per hour. So one block will get you $150 in a day. So that is a huge additional income that you can join. But with the help of dentistry, with the help of the medical terminology that you have, the knowledge that you have, the things that you have, because you have learned first and second and third year, all medical subject you have learned. So you have a lot of knowledge and a lot of things with respect to medical and dental. You can actually, if you put some effort, you can combine both and you can get better aspect with respect. Then comes pharmacovigilance is another opportunity. Non-pharmacology, non-dentistry practice, the certified courses in pharmacovigilance is a 4 months time. There is a diploma for 1 year time is also available there. Many multinational MNCs appoint this pharmacovigilance. That now it has become a very gold standard to appoint a person who is certified in pharmacovigilance. What they do is the certification or the quality of the product that they are bringing out, and the pharmacovigilance officer certificate is very important there. So that is very important at this point of time. And you can, as a dentist, again, we have studied Tripadi. You know, Tripadi part 1 and part 2 we have almost covered. So you have all the terminologies of the medical terms with us there. And starting salary from 35,000 to 50 to 75 to 1 lakh goes on depending upon your company and ways that you work it. Now, what is this? ICD 10 CMA. It's nothing but it's a coding. Now, medical coding or coding is coming. As you know, it's the world is going into medical coding. Again, that is also a good opportunity to learn a passive income for you. In home, you can do all those things. Depending upon the international company, it will be a time schedule will be there. So they will give you allotted time. This time you be online and they will give you the data and you do the coding and give them back. And you can see average salary is more than any other field. You can earn a lot. Since you are a dentist, you know the medical term, it will be so easy for you to do that. You can go into this website and find out opportunities. You can get there. Any training if you want, you can get from there. Forensic science is another thing that you can do. There is a diploma, there is a BSc and MSc in forensic science. It's a big thing that is coming up there. So there are some universities who offer forensic science, which is very much recognized at this point of time in India, like a government, which a college in Kerala, Calicut University, Amity and Lovely Professional University in India gives a forensic science diploma to BSc to MSc there. Forensic science in India, the scope outside, these are the universities in outside India which are well recognized and reputed in India at this point of time, outside India at this point of time, who gives you a good forensic science diploma or a degree that you can search for it. Odontology is again a PG diploma in forensic odontology, like MSc forensic odontology, like universities. These are the universities which offers them. This also works very good, and the topics are included in this, and it also pays a very good. It's coming up. It's not very much at this point of time in India, but slowly this forensic science and odontology will become future, because in criminal case assistance, you might play a very important role and it may come up there. So guys, remember this phone call in this phone in 90s, 70s or 60s and 70s in India. Then it changed into a phone like this, and now we have. So there is a change in innovation and technology at any point of time. So what I want to tell you is you have to sharpen your axis. If you see a if a person who go to cut the wood, he will sharpen the sword or the axe every day. He will sharpen before going to cutting. Why he sharpens? When it is sharp, you need to put less effort and you get maximum benefit. If you do not sharp, what you need to put? You have to more effort and less benefit you get. So every day you need to sharpen your axis there. So upgrade your skill is very important. One person I want to tell you, I don't know how many of you know Dr. Vijayalakshmi Acharya. In 65 years, still she learns. She sits and learns and upgrades, and her clients are not other than the superstars there. So happy to be with her one day at 3 days of interceptive myofunctional course, because she want to learn about early intervention and orthodontic management. That is the attitude you should have. Even though she's an endodontist, she does every cases in her clinic there. That attitude is very, very important. So I want to conclude by saying that 2 seeds were lying down inside the ground. They were lying down. They were very happy. They were happy. So they were discussing, and one seed said, "This is too much. Such a long time I have been suppressed inside. I want to grow up and I want to sprout out." So the other seed said, "Do not go. There are eagles, there are hen, there are birds, there are animals and humans. If you come out, they will eat you. You are gone and nobody will observe." But this seed decided, "No, I'm ready to take the risk. I'm going out." He sprouted, and then after some time, he became a big tree. He started producing lots and lots of fruits. People started coming and sitting under him for the shadow, and the fruits they enjoyed. They all adored this tree. The other seed was still inside the sand. But one day, this one hen came, a bird came, and just removed the soil, and he found out the seed and ate the seed, and he's done that. So what I want to say is that if you see the greatest people in this world who come up like in Amazon or anybody, they started from scratch. From simple beginning they all had. Anybody, if you see, all started from a single or simple beginning there, and they become famous there. So it is for you to take the risk. You need to take the risk. That risk will meld you. So you have to come out from the comfort zone. You have to wake up from the comfort zone, take the risk. What talent you have, identify, take the risk and mold the risk, you will become successful there. So this is what one message I want to tell you. Have a daily routine in your problem. Have a daily routine like get up early, focus oriented thinking, positive people around you, goal oriented life, read books and get more knowledge, and sleep well there. So 3 is a consistent and continuous thing can bring you best there. So to conclude this session, I talked about what is your next chapter. Are you ready to practice now? Are you ready to go abroad? Are you ready to start a clinic? Or what is your planning to leave dentistry? What is that? Please leave the negativity of your life there. It's you and only you who can mold it, nobody else. Do not follow the success of somebody. Please go to the success. How did they reach the success? So see the failures they have. Edison had hundreds failures. 101 was his success. So any success in life, if you follow, it's blind. But see how they reached into that success. They have went to do multiple failures. You can avoid those failures if you read the failures there. So I want to tell you is that always look into the failures they faced. Avoid those failures so that you can be successful. Come out of the comfort zone and prepare yourself there. Me sitting in front of you for the past 1 year started with a simple clinic in a very rural area, which you can see in 1999 and 2000, I started this clinic. After passing out from my BDS, we started this clinic in 1999. I passed out in 1998 and I started this in 1999 to 2000 with my brother. Started something like this. This was the beginning stage of me, and I'm telling you, in a very rural area, not an urban area there. But at this point of time, if you come, my clinic is been improvised into this setup. This center, I have 2 centers at this point of time, and it's a regular flow of patient that is happening there. And I have records in Limca book, in Asian book, in India book. This is the connection I established. I travel across India. I have friends in Bengal, West Bengal, Orissa, Assam. I have friends in UP. I have friends in Jammu. I have friends in Gujarat. I have got connections from Bombay, Pune, in Maharashtra, anywhere in country. If you ask me, Dr. Joby, I have friends. They are refer patient. If we get connected, I can refer them. How did I get? I get connected with them. I'm not telling you to do something like that, but I got connected with them. That connection is still persisting and still holding on to that. Now, dentistry, if you see, it's the highest paid, one of the highest paid healthcare job in US. Third is dentistry there. Per annum, if you see, dentistry is highest paid there. So dentistry is flourishing, is going into the next level only for those people who are ready to chase their dream. If you listen to Dr. Henry Ford, he said one beautiful statement: a market is never saturated with a good product, but it is very quickly saturated with a bad one. In dentistry, it's very true. Do not look into the easy way in dentistry. You have to step by step give time for your practice. Dentistry can be rewarding. You will be rewarded. You cannot become a big dentist or a practice in a day, in a years, in a decade. It takes some time. Give the time. Be with this. If you have passion for it, if you trust for it, okay, the choice is yours, guys. So I hope I have not left you something like this. You are putting something like this and doing it. So mind is like a parachute. It's best when it's open up. Open up your mind. See the best perspective, which is best for you. See it. You select it. You train hard for it. You will become successful. This is like Saturday evening, going to hostel, going to your room after the entire day practice there. And this is like Monday morning, back to college, back to the cleans day. Thank you so much. Thank you for the opportunity, and the entire team, Dr. Simran, thank you so much for this opportunity. And I hope I did justice. So I'm open for the discussion now.
Thank you so much, sir. Indeed, you not only, thrown light on what we should do after BDS, but you have also motivated us in a way that we can do something. It was indeed great. And you have covered every perspective what after BDS. You have covered every exam. You have covered every, what extent we can go, medical writing. Not everyone covers this. You have covered everything. So thank you so much, sir.
Thank you.
Now we open the ground for question answers. If anybody needs to ask any question, they can directly ask, sir, or they can write it in the chat box. So we are just waiting if someone writes the question.
Yes. Even our WhatsApp group is there, so they can put any questions, so they can ask the queries regarding that.
Can we connect to Dr. No.
Yeah, Dr. Kamna is one of the person in the Australia. So that person who has said that you want to connect to Dr. Kamna, please message me first and let me interact with her, and she's free at the time. I can ask them to connect. No problem, no issue. I will support that.
So there is one more question. What is a deputy medical superintendent?
Okay, what is deputy?
Medical superintendent.
Superintendent.
Yes,
superintendent. Yeah, medical. See, that is a post. See, you have to understand that even in government, there are different posts will be given there. So some condition they will give you as an initial post as a medical officer, and you work for a certain period of time, you get upgradation to medical superintendent post. Like ESI and all those hospitals, you might get a post like that. Some government offices you get directly the post of a medical superintendent post there. So here, what you will be doing is you will be the entire hospital. You will be managing the employee, the doctor, the workflow, everything you will be managing in that office there, in that particular setup.
Okay. So next we have in the same question, what are the credentials to get into it? Like I think you have explained it.
Yeah, explain. UPSC
Yes,
is there.
I think we are done with that question. So next question is, I have read somewhere about corporate BDS. Can you explain me about that?
See, corporate BDS, for example, you might have heard about Cloud Dental is a chain of dental clinics across India at this point of time. Something like that. There are multiple corporates that has come into field. Early, if you remember, there is like a Vasan Eye Care, which was there. We started Vasan Dental Care across India. They started. They are corporates. Like Apollo Hospital is a corporate medical set. Something like they can come up tomorrow with Apollo dental clinics there. Even though their hospital has got dental setup, they don't promote. So these are the corporate companies, private corporate companies, which comes with a standardized protocol, and they start establishing in multiple cities there. So you will enroll into that, and they will call for dentists. They'll take an interview. If your credentials are good, they will appoint you as a corporate, as an employee in the corporate. So it could be anyone. It could be a dental, it could be a physician, it could be even a neurologist or a nephrologist, anybody they appoint, and they have to work according to their norms, and that is it. You work under them, they will fix a salary, they will fix everything. You work under them as a corporate dental officer for them.
So next we have, sir, can I know more about forensic odontology?
See, forensic odontology, it's a very good upcoming branch at this point of time, because the workforce at this point of time is very less, but it will take some time, because the nowadays it is usually very less amount of incorporation of dentists is there with the identification of the forensic science at this point of time. But in future it will be good, but not in India, outside India, countries like UK, US, New Zealand, Europe, it has got a good scope, because a certification from a forensic odontologist is very important. And see, they put lot of research into the odontology subject, the evolution and evolving of human beings there. So they have a lot of scopes in outside India. Slowly and progressively, maybe 10 to 15 years time, in India also there is a good opportunity will come up. But I'll tell you, keep on shifting at this point of time. At this point of time, let me tell you frankly, in our country, it is not that much compared to the scope in outside country. Your voice is muted, doctor.
Sir, are there any website links for learning medical coding courses?
There are some websites. See, every website has give you an initial thing that if you want to learn more, register for courses kind of things are there. You can search for it. For coding, there are learn and 12 days, learn medical coding in 1 month or something like that are there. So it is possible. See, coding is online learning is enough, because it's all technical terms and all. There is no human practice that you have to do. So any good search for the credentials of the company, of the institute, and learn it. That is enough that you can do that.
So the next question is, how long do we have to be patient to start a decent amount of earning in dentistry?
That is a $1 billion question actually.
True. A lot of patience.
Yeah. You see, first and foremost, let me tell you, you need a good patience to learn good amount of earnings from the some months you will earn more, some months you will not, but there is no time frame. Be frank, time frame is there to earn the good amount. It is depending upon the your experience, your practice, your area of practice, the conditions, the everything. Lot of factors are there. But be patient. If you are genuine, ethical, and if you do it, it will come to you at one point of time.
It requires a lot of patience.
Yeah, 100%.
It do. Okay. So the next question is there any organization or website which provide pharmacovigilance certificate courses?
Yeah, I showed you. I showed you in the website. There are 2-3 institutes which gives you pharmacovigilance courses, diploma courses there. So you can go into that.
Okay. Sir, the next question is, sir, can I know the amount for getting license to practice in foreign countries like UK, Canada?
I told you now, if you want to get license into practice, minimum you have to spend around 50 to 1 CR in Indian rupees. That depends upon, see, if you are one exam you give, there is no guarantee that you will pass out. There is a repeat chance. Like that, some countries have got 3 chance, some countries got 4 chance. So each chance you have to pay 30 to 35 lakhs will be your cost per exam. So some countries will give second chance, you get an option, third chance you get an option. Sometimes you might be totally rejected. So average, I told you, 80 to 1 to 1.2 to 5 CR make ready to get practice into these countries. That is why many of them go there and work as a part-time job. They earn money. Some people, I know that some people have worked for 10 years and got that money and then got license.
So there's a person who wants to ask a question directly. I have unmuted you. Please accept it.
Yeah, please. I'm ready.
Yeah, please. I've requested to unmute you.
Hello, sir.
Yeah.
Yeah, thank you, ma'am. Thank you, sir. So, hello, sir. This is Pooja LNG, a BDS graduate who just graduated from Ramchandra University, Chennai. So, my question is, sir, I'm a very average student who secured 60 to 70% almost every year till the final year. And right now, I've realized after internship that I'm actually physically exhausted by doing cases. Is it possible? And I'm thinking about courses like MBA and settling in working for a corporate dental company, or maybe setting up my own clinic and doing the administrative process. So is it really possible for me to not do cases but still look at the administrative work and still earn decently?
Dr. Pooja, see, I do not know what is, to be frank with you, I do not know the alignment and the severity of that, but never start a clinic depending upon others and thinking that I will be able to administer them and able to correct them at this point of time. And my sincere advice to you, do not start a clinic at this point of time and say that I will administer others and manage them at this point of time. It's very tough. If you are very strong in that, you can do further. For you, the option I would suggest at this point of, because I don't know much of you, is that the non-clinical subjects and its scope. If you said you are an average student, that's more than enough. Little more effort you put, little more patience you have, you work on to the non-clinical perspectives in dentistry, like a research. Believe me, dentistry and research in India is very less. 2 to 3% only is happening in India. Imagine, across the world, there is around 70 to 80% are spent on research. In India, 2 to 3% is only happening. Very limited research is happening in dentistry in India. So your eyes and your effort should be more into the research and non-clinical associated things at this point of time, and that would be a better perspective for you than the clinical cases and managing and administration there. So this clinical research is best in outside than in India at this point of time. You get established, you do a good clinical research and do that, get into a good company, and then you can always come back to India after 10 years or 15 years or working in that with that guidance, with that information, with that backup. You can come there, you can start your own thing, your own setup in India, or collaborate with the companies in India, and you will be one of the best person in that, Dr. Pooja.
Sir, one more question is there. Is Indian dental degree is acceptable in other Arab countries, Malaysia, Singapore countries?
No. None of the countries Indian degree is accepted. Even in Arab countries, I did not put Arab countries, but BDS is at this point of time, early in 90s and 80s. In 80s and 90s, BDS and you give the licensing examination in Arab, it was accepted. But now they ask MDS now. So they've gone from BDS to MDS. That's why I did not put. Even MDS, they have to give a licensing examination.
Sir, I think we are done with the questions.
Oh, great.
And it was indeed great connecting with you, to have you as our speaker.
Thank you
It's
so
really
much.
very great for us, for our platform, and definitely Online Dentistry and FindUtsav will definitely keep on conducting such webinars that are definitely going to add value to the student level. Sir, there is one more question. Sir, is any country that accept Indian degree?
No. At this point, it is not.
Not. Indian degrees are different.
Yeah.
They are not accepted anywhere. Okay, great. So thank you so much, sir, and thank you to all the participants for being here and attending the lecture. I hope it would have added to your value. Thank you so much. Sir, I think so we should conclude it now.
Yeah.
Thank you so much.
Team. Thank you so much. Good night to all. Thank you so much.
And participants, I have put in the Google form. If you need the certificate, if you want certificate for this lecture, please fill up the form. It is there above in the chat box. I will again post it just to, tag it. Just a minute. I've sent it in the chat box. Please go through it and fill the form. Thank you so much, everyone. Thank you so much, sir.
Thank you. Good night. Good night. Good night.
Good night, sir. Good night, sir. Thank you.